The fourth question is from Deputy Catherine Connolly, please.
Minister, it's been reported today in the media that there's a wide gap in relation to Brexit between the EU and the UK, and you've referred to that yourself. And there's certainly a wide gap between Boris Johnson's understanding of the Supreme Court judgment and what they said. So I'm borrowing from that language in a different area, and I'm talking about an even wider gap between the government's commitment to deliver a public health system and the reality on the ground, while we're talking about gaps. And as you know, I've raised Galway on many, many occasions in a constructive manner, and I have highlighted repeatedly that the hospital is not fit for purpose. Your previous leader and previous Taoiseach of the country in 2015 said accident and emergency wasn't fit for purpose. The current leader of Fianna Fáil has repeatedly endorsed the same thing. A hospital with 43,000 people on a waiting list. 2 theatres closed in September 17, 1 still closed, and consultants writing to us about the catastrophic regional waiting list. 64 nursing vacancies. Today alone on trolleys, 47. Now I'd invite any member of the government to go onto a trolley, even for a day, and remember Dr. Hickey's words in Sligo. 300 premature deaths every year directly related to the time spent on trolleys. Last week, on this day, 49. In August, 655. And an options appraisal for the future, which is very positive, but it's gone into abeyance. I mention all of that by way of background to the question I'm now going to ask, Minister, so you can relax, because it's a very simple question. That's a hospital and a public health system creaking at the seams. I'm going to look at primary care now, which, according to the Minister, is going to be the focus, and he's going to focus on developing a strong and efficient primary care system. Over and over these words have been used. Now we look at Galway in relation to primary care, which is essential of itself, but also essential to take the pressure off the hospital. So just let me give you a specific question now, and I might get a specific reply. We have 11 posts. My colleague here has a letter, and there's over 100 posts. So starting with a senior occupational therapist, audiologist, physiotherapist, dental surgeon, and so on. Now, the point is, they have gone through the process, they've gone through the Garda vetting, they've got their jobs. Can you imagine that? Celebrated, got their jobs. And what happens? You can't take that position because we're waiting on sanction from Dublin. That's the letter we're being shown, that's the letter my colleagues are being shown. Now, can you tell me, and don't give me rhetoric, and don't give me something I don't understand, please, Minister, why can those posts, those people not take up their posts if we're seriously interested in giving primary care? As I speak, Connemara, Creelor na Gaeltachta, Neil Post on physiotherapy, Tá Orthu Gullis Jock G on Chahar. At the moment, there's nobody covering Connemara, and all of the patients or those looking for physiotherapy have to go into the city. So my specific question, please, is there an embargo or is there not? Thank you.
Thank you, Deputy Minister.
Okay, well, as I understand it, there is no embargo. But just to say that, you know, set out in you know, you talked about issues around the hospital and trolleys. And just to say that since 2017, an additional 267 acute beds have been opened. The capacity programme for 2019 provides for a number of increases, and that's the provision of 75 acute beds and 70 community beds under the winter plan, 47 additional beds in 4 high dependency unit beds in Cork University, 3 in the Mater, and a 40-bed modular build in South Tipperary General Hospital, and that's due to be operational in the first week in January. And the preparation of 202 beds, of which 16 are critical care during 2019, with a view to bringing this extra capacity into operation in Q1 of 2020. Regarding home care, and you mentioned that, and just to say that over 1.8 billion is available for 2019 for older person services, 985.8 million for nursing home support scheme, and 862 million for older person services. And despite this significant level of funding and service provision, demand for services continue to grow, and the HSE is required to manage its budget and service provision throughout the year to ensure a balanced budget for 2019. As outlined in the HSE's National Service Plan for 2019, The HSE maximises the utilisation of current resources, prioritising those requiring discharge from acute hospitals, and significant resources and services in 2019 has been targeted to facilitate timely access. In winter of 2018 to 2019, the immediate focus was on reducing delayed patient discharges through mobilising the additional resources made available and ensuring that social care measures were effectively deployed to enable older people to move to a more appropriate care setting, including to step down or transitional care of their own home with the supports they need. The Department of Health is engaging extensively with the HSE in the context of planning for winter, including consideration of the response to dealing with the current challenges, such as the high level of delayed transfers of care. And while this engagement continues, the HSE has been authorised to undertake immediate action to mitigate the challenges. Engagement will continue over the coming weeks, having regard to the estimates 2020 process.
Thank you very much, Minister. Deputy Connolly.
We know that from Oughterard lately. And part of the democratic process is for the opposition to hold you to account in language that the ordinary person understands. I've asked you a very simple question. Why I've 11 posts specifically in Galway, and I've referred to my colleague, and there's a list of 100 and something up in Donegal. They have received the position, vital posts, in a vital pillar of your health policy, primary care, which I agree with. Did you direct the Director of the Health Executive not to fill these posts? Have you had a role in that? Has it been drawn to your attention prior to me drawing it to your attention? Now, you talk about balanced budgets. Is the message from this government that the budget will be balanced at all costs, and we will not fill these posts in the interest of a balanced budget, in the interest of having a surplus? Is that what I'm to go back to Galway and tell the Galway people, or tell the people on trolleys? I'll tell the 43,000, now I'm on waiting list. I made it easy for you. I'm asking you specifically. They're being told they've gone through the process. I'm now repeating, which I don't like, but I really wish you would answer my question. How can you stand over 11 posts? And that's only the top of the iceberg. Please, either say you're in favour of that or you're not, or you don't know anything about it and you'll check. But please, give me an answer that I understand. Thank you.
Thank you, Deputy Minister.
Thank you. Just to say, Deputy, just to give you an update on Galway, the design for the new emergency department at Galway University Hospital is at an advanced stage. There's a 7-storey design, including paediatrics and maternity services. I'll get to your answer now in a second. And they're awaiting planning permission to be lodged, and that most likely to on board Penala. And I know you've asked me a specific question about posts, and I can't answer you because I don't have the answer here. But what I will do is I will bring your specific concerns to the Minister regarding the issue that you have raised with me this morning. And thank you for raising it.
Thank you very much, Minister. That concludes Leaders' questions.